Following lectures, we're going to talk about some of the bigger nerves in the upper body that can get damaged, trapped, compressed, and stuff like that. So a lot of the injuries that people tend to get from kind of nerve entrapment in the upper body is going to affect at least one of these nerves. Okay, so in order for you to see exactly where these nerves are, I need to multi-select them individually. So obviously it's not really an easy job because there's just so much going on here. But in order for me to uncover the three main nerves, I'll be looking for like the thickest and like the biggest nerves I can find. So for example, comparing these different lines here, I'll be looking at, for example, this one, which is the median nerve. So you can see it's quite big, and the ulnar. So if you imagine the median nerve beginning from the brachial plexus there, going underneath the clavicle, traveling in through the axillary region between the biceps and the triceps alongside the ulnar nerve, but then splitting towards the bicep tendon, which is here, and then going through the midline of the body, of the forearm, until it gets to the to this point there, where we can essentially where the nerve is going to spread. So it's going to spread into the thumb like this. It's going to also spread into the index finger, and it's going to spread into the middle finger there as well, plus a couple of little branches going towards the other fingers, but not really going all the way into the fingertips themselves. It will travel very closely to the median nerve through the axillary region between the biceps and the triceps, but the moment the ulnar nerve gets to about there, it's no longer going to continue on the same path as the median nerve. It's now going to go towards the medial aspect of the forearm. So as you can see there on the drawing, it's going right on the outside of the forearm, and then it's going to connect into the little finger. It's also going to connect into the ring finger. Okay, so this is how we've essentially completed all 5 fingers onto the anterior aspect of the hand. So if anyone's struggling with golfer's elbow, potentially this could be a ulnar nerve compression. So that you could have compression somewhere along the line of this nerve. It doesn't have to be local. It could be anywhere along the pathway of the body of the nerve, and that could be sending signals into the medial aspect of the elbow, basically, which could replicate the symptoms of golfer's elbow. But overall, golfer's elbow is something called medial epicondylitis, which is an inflammation to the tendons of some of the forearm muscles that attach onto the medial epicondyle. That's the the anatomical explanation of what golfer's elbow is. But most people know it as just like inside elbow pain. Essentially, the ulnar nerve will pass through where the bones of the elbow are. So if you touch your elbow there, you're gonna see that you got 2 bones. That's the olecranon process. That's the medial epicondyle. So the ulnar nerve essentially is located in between those 2 bony landmarks. So this is how closely it travels to the bones, and then whenever there's muscle tightness or something pulling on the tendons or the muscles, that could be causing tension on top of the ulnar nerve itself. So it's going to go through the triceps, as you can see there. It's going to go through the aspect of the lateral elbow there as well, and then it's going to come all the way down into the wrist, and then it's going to spread into the fingers. So basically the radial nerve is responsible for the posterior aspect of the entire arm. So it's going to innervate the triceps, the wrist extensor muscles, which are on the top of the forearm there. It could relate to injuries such as tennis elbow. Okay, so we talked about golfer's elbow, which was on the inside. That was a ulnar nerve compression potentially. Now with tennis elbow, we could be looking at radial nerve compression.